A coordinated care plan is like a personal roadmap for health. It can help a person and the people who care about them to know what to do when help is needed. Really, all of us should have a coordinated care plan. Everyone. That way, if we do need care at some point, people who know us and care about us will have a good idea how best to help. But a coordinated care plan is especially important for people who have persistent health problems or have several health problems and possibly different providers involved in their care. Let's begin by meeting Alan. He's someone who might benefit from having a coordinated care plan.
I used to have my own construction company. My father was in construction and I took up the business when he retired. I enjoyed that little company a lot and I could support my family. But when I started to have health troubles, things just fell apart. About 4 years ago, I had to give up the company and go on disability because of what turned out to be Crohn's disease. I get such bad pain in my belly, and sometimes I can't control my bowels. Not a good combination for keeping up with work. I seem to be taking a lot of medications, and they change all the time. I have a family doctor, 2 specialists, a dietitian, and a pharmacist at the hospital and another one down the street. The advice I get from one of them often contradicts what another one said the week before. When the pain in the bowels get out of control, I get really frustrated and don't know what to do. What to take, I don't know who to call. So I go to emergency at least once a month because they'll give me a shot that will help for at least a few hours. But they seem really upset when I show up. I would love to get back to work, but that's a long shot. Even if I could be comfortable at home and read to my kids at bedtime, that'd be a big improvement. I don't know how to stop this treadmill, but I sure would like to.
Sometimes a person's health problems can turn life into a constant crisis. For Alan, it makes it worse that his healthcare providers are not on the same page. They seem to react to everything that happens, but no one has really looked at the pattern over the long term. They don't know how frustrated he is. There doesn't seem to be any plan, but maybe that could change. Finding a care coordinator. Making a coordinated care plan happens by talking to people and writing down what is important so that everyone knows. It helps if you have one person who can take the lead with you on this. That person is called a care coordinator. Some of the people who can be your care coordinators are your family doctor, a nurse or a social worker who knows you well and who you trust. If you know one of these, talk to them about helping you to make a care plan. Getting started. To begin making your care plan, you should take time to think about a few things. Recently, what has made you go to the hospital? And what could have worked better so you did not need to go? What works well for you with your healthcare and what is not working so well? What matters most in life? What are your goals and what is important to you? Then, gather all of your medications. Collect your bottles and your weekly medication packages and any lists from pharmacies or healthcare providers. Finally, think about which people know you well enough that they can help you with decisions about your healthcare. For example, you may have specialists or neighbors or home care workers who could help you to make the care plan and who need to know about the plans you are making. You might even talk to some of these people about what you want to have happen with your healthcare. These are your helpers. Having your helpers at the table sometimes makes it much easier. Your care coordinator might ask you to sign a consent form so that these other people can be invited. The Coordinated Care Plan Tools. The tool used to collect this information may differ, and some people may not need to use all the fields, but here are some fields that are particularly important for you, your care coordinators, to discuss and to communicate to anyone you see for your healthcare. About Me demographics. This includes your preferred name and how best to contact you. My Care Team, the key people in your life, from healthcare providers to community services to your friends and family. Anyone who is involved in your life and healthcare who you would want this information shared with. My Care Needs, the supports, assistance, or devices that you use in your everyday life. My Plan to Achieve My Goals or My Action Plan. Your care coordinator will discuss your goals with you. With your preferences and your care team's clinical expertise, they will help you to plan ways you can meet your goals. My coping plan. What to do when you encounter certain situations. Often, this is used to plan for the next time a situation comes up where you weren't sure what to do in the past. Medications. The medications that you currently take, the how often and how much. Getting specific. You, your care coordinator, and your helpers should talk about this information on the phone or in person about what matters to you, what some of your challenges and goals are, and who you want to know about your care plan. The Coordinated Care Plan tool is a great way to get started with this discussion, and also a great way to keep notes as you talk. Let's hear from Alan again. When Alan met with his care coordinator and his family doctor, he pointed out that his pain control was not good and that he often received scripts from any doctor he saw. His family doctor realized that she had no idea about Alan going to different doctors, and that the specialists probably did not realize anything about Alan's hospital visits, nor his pain control either. Because his pain control was so poor, many of Alan's emergency room visits were to get more medication. Alan talked about what matters to him in his life and pointed out that his main goals were to control his pain, mentioned that he loved his work. Alan brought in his current medications, which were different than what his family doctor had on record. Alan talked about his helpers, being his family doctor, whom he sees regularly, and his sister, who he doesn't see as much as he'd like. Based on their conversation, the care coordinator works with Alan and his helpers to create an action plan. The team checks the medications that Alan has brought to the appointment and documents his current list. They decide they need to have a single medication list to control Alan's pain and ensure his GI specialist and pain specialists are in agreement and aware of the plan to avoid duplication. Once they finalize a list, this information is documented in Alan's care plan. Alan's care coordinator also finds a pharmacy near Alan's house and arranges for his medication to be delivered so that Alan will always receive his refills when he needs them. Alan mentioned that he loved his work and wishes he could return, but had found it difficult to keep up with the schedule while managing his Crohn's disease. Alan's care coordinator tells him about a program that can arrange for him to work occasionally and on a flexible schedule through a community agency near Alan's home, and encourages Alan to pursue. She submits a referral and lets Alan know that a coordinator will call him directly. They also agree that if Alan is considering going to the hospital for his pain in the future, that he can call his care coordinator or his family doctor's office, who can help him decide if he should go to the hospital or if there's something they can do in their office. Alan, his care coordinator, and his helpers fill out the rest of the relevant fields of the tool. What to do when the coordinated care plan is finished. Once you have finished your coordinated care plan, you should be sure that it is easy to find at your home, so you or your helpers will see it right away if they need to. Some people find the best place is on the fridge. Then you should give a copy to everyone who can be helpful, like your family doctor, your specialists, and all of your helpers. Finally, your care coordinator can be sure that your plan is kept at the hospital so that doctors and nurses there can refer to it if you are in the hospital for any reason. Another way you can access your care plan is through a personal health record. This way, you are in control of who has access to the care plan and who does not. Is that all? Well, no, that is not quite all. As you know, people don't stay the same. Their bodies change, their opinions and ideas change, their treatments change, and their helpers change. So, your coordinated care plan will have to change from time to time as well. You and your care coordinator should choose a time when you will review and update your coordinated care plan. For many people, it works well to review 6 months later, but for you, this might be earlier or later, and that's okay too. Let's meet Alan again. Alan has some things he can do well. He has some things he would like to accomplish in life. He also has some health challenges that make it difficult to achieve his goals. His healthcare providers have not always understood what his goals, abilities, and challenges are. When Alan made his care plan, along with his family doctor and his specialist, it suddenly became much easier for him to meet his goals. In the past, he often had to go to emergency because he didn't know what else he could do when his symptoms got worse. Since he has had a care plan, his medication schedule has been much better. This means his symptoms have also improved, and when his symptoms do get worse, he knows some things to try at home on his own. If that doesn't work, he knows who he can call to get more advice, day or night. He only had to go to the hospital emergency once in the last 6 months when none of these things helped. So, Alan is pretty happy that he made a care plan, and soon he will meet with his care coordinator to review it. Everyone's situation is completely unique, so what works for you may be different than what worked for Alan. This is why it is important for you to create your very own care plan. Hopefully, you will be as happy with your care plan as Alan was with his.